Around 80,000 South Sudanese children got life-saving vaccinations during World Immunization Week in April, and that was in Juba alone. But the World Health Organization's DRC LUN says there is still a long way to go in South Sudan to make sure more children get the full range of vaccinations.
We're always trying to improve routine immunisation. These outreaches are fantastic. They're trying to address the needs and the gaps that are in maybe the routine immunisation schedule. So ideally what we want are mothers and parents to take their children to health facilities.
Angelina Tong did just that. She brought her 3 children to get vaccinated at this health facility near her home in Juba. First, she set a good example for her 3 children and rolled up her sleeve to have a tetanus shot. Then it was the kids' turn. They were given the oral polio vaccine and measles shots. Tong says she's glad she came. She says vaccinations will protect her children from disease and allow them to live healthy lives. Lun wishes more mothers in South Sudan were like Tong. She has heard the message about immunization loud and clear.
Ideally, we want to create the demand for health services rather than, it's called a push-pull system. At the moment we have to push immunisation onto people to make sure that every child is safe, but ideally what we're looking for is a pull system where parents and particularly mothers can demand immunisation for their children to get them vaccinated and keep them safe for life.
Lun says the most recent data for South Sudan show that only around a third of children are fully immunised.
So to close that gap between fully immunised and those not being immunised is a big task because we're looking at almost 70% of children who are not getting fully immunised.
The World Health Organization says 1 in 5 children around the world are still missing out on life-saving shots, and 1.5 million deaths a year could be prevented if more children are immunised.